245,000 licensed doctors, 80% are made up of women. Only 40% of these ever come back to practice. Next time when I conceived, I just didn't think the second time.
Right.
And I quit. I think very early on we realized that for us, gender is going to be secondary. So when we are entering into a meeting, we leave the gender behind. I feel all the medical colleges now should have telemedicine and digital health bit embedded in their course.
Hello and welcome everyone to episode 62 of Digitales. My name is Faizan Syed, founder and CEO of East River. And today I have with me someone who has started a super app in the healthcare space in Pakistan. This app was launched in 2017. It's called Sehat Kahani. Dr. Iffat, how are you today?
Hello, I'm great. Thank you so much for having me here.
No, thank you for being here. And we've been following the journey of this super app. And you're one of the co-founders. There are two co-founders. You're one of the two.
Yes.
Walk me through how you came up with this idea of a healthcare app where telemedicine will be made available to everyone in Pakistan. Like, how does someone come up with that idea?
So I think, you'll have to look at the basics. We both are female doctors. And a major challenge that Pakistan has is that a lot of women graduate,
Right.
but they don't practice to their full potential. And this is a challenge that kahin na kahin in our journeys as well, both me and Sarah, we've probably faced it, or we had to, go through phases in our lives where we had to either choose between, having to work or having a family.
Right.
And I think that's how the initial concept started. If I talk about myself, I was working in the pharma sector after graduating from Ziauddin. And I think, pharma is an amazing, experience in itself. You get the opportunity to do a lot of outreach. There's a lot of traveling. But me and my husband, we ended up losing our first child in a premature birth.
Okay.
So while no one really told me to quit job,
Right.
or no one was not supportive, which is not the case in a lot of families in Pakistan, but there was so much external noise. I remember, people conversing that, she used to travel a lot, her office didn't have lift, maybe she
Right.
wasn't careful enough. So it becomes, a lot of guilt and remorse associated with it as a parent.
Got it.
So the next time when I conceived, I just didn't, think the second time.
Right.
And I quit. So
Right.
that's how, when I resumed work, I met my co-founder, Sarah. And, she was working on this exciting pilot, having gone through her own challenges as well, that if women, especially doctors, got the opportunity to work online, there could be so many physicians who could be remobilized and re-engaged.
So you were actually solving the problem from a doctor's perspective, not
Yes.
from a patient's perspective.
So, and they were linked.
Because there were a lot of women doctors who just weren't practicing. And in fact, I think the statistics show that in Pakistan, med schools have more women students.
Absolutely.
Therefore, more women graduates. And most of those women are not practicing.
Yes.
And that is the problem you were trying to solve.
So Pakistan has 220 million
Right.
plus population.
Right.
50% don't have access to healthcare. And the major reason we as physicians realize is that women are in every profession. But if, for example, a woman engineer doesn't work, there's a male engineer working on her behalf.
Right.
But when you look at the dynamics and the numbers for doctors, 245,000 licensed doctors, 80% are made up of women. Only 40% of these ever come back to practice.
245,000 licensed
Yes.
doctors of a population of 220 million.
Yes.
That's,
And even in that, 80% is made up
that's
of women.
0.1%.
Yes.
Basically 0.1% of our population is doctors. And you're saying that of the 245,000
Yeah.
registered doctors, how many are women?
So around 80% of these.
80% are women.
Yeah.
That means 100 and let's say, wow, almost 200,000 are women.
Almost a big number, big number.
And of the 200,000 that are women, roughly, let's say, how many of them are not working?
So only 40%, as per the stats, come back to practice. So we have a good 60%
Of the women doctors.
who don't work. We don't know where they are, whether they changed professions, they moved outside Pakistan or
Okay,
what.
this is unbelievable. So you're telling me there's 45,000 male doctors and only 80,000 female doctors. So there's literally actually only 120,000 practicing doctors.
So if you look at the numbers, the stats say we have 0.5 doctor for 1,000 patients. which is nowhere near what WHO.
What should be the number for us?
The
Recommended for
the
like
recommended
our type.
number is around 1.5 doctor or around 2 doctors.
2 doctors. So we're literally a quarter of that.
Yeah.
Okay, interesting. That's eye-opening statistics. And so you're thinking that, and so your idea with your co-founder Sarah Huram
Yes.
was to bridge this divide
Yeah.
and be able to provide access, if not in person, then through technology.
Absolutely. And even, that was a very interesting experiment. Sarah had to shift to Lahore. She was working in a clinic here, but when she moved, the clinic couldn't find a doctor. So the nurse started calling her. That call turned into a video call. And, that idea generated from there that,
So she
if
was the first
could-
listed doctor of her own app, huh?
Yeah. So, if she could do it,
Yeah.
there are so many, doctors who are not being tapped at the moment who could really do this.
Interesting.
Yeah.
And so you guys got together, you then decided, you saw it more from the career side, she saw it more from, let's say, the end user need side. But when you decided to get together, how do you guys, co-founders, how do you split responsibilities? How do you decide who does what, who's better at what? Because it's difficult to have two people always agree on everything.
I think so the beauty of our relationship was that we started as co-founders or started as partners and not as friends. So that baggage or that expectation that you have as a friend that, even if I'm wrong, they should understand me, wasn't there.
Right.
We always were really spot on that work is our priority.
Right.
And I think over the years, we really became close as friends, as people.
Right.
And we are really opposite as people. So that creates a really, I think if you talk to any team member of ours, I was just getting this feedback, I think 2-3 days ago, that we make a really great team because we're different. So we have a different thinking process.
Right.
So for example, if you speak to Sarah is very, agile. She's someone who wants things done quickly. I will take my time in deciding and,
Right.
coming to a conclusion.
So you'll help her slow down, she'll speed you up.
Yes. I think that makes
Okay.
the perfect mix.
Right.
She is very detail oriented. While I'm that, big visionary, I can just jump from one dream to another.
Right.
Oh my God, this is what we should
Right.
build. But the steps
So you
needed
can
to go
help pull her
there.
out of the weeds, whereas she brings you back down to earth.
Yeah. She'll
Okay.
be like, okay.
But
if we have
did you
to
guys
build
know this when you were sitting down and laying all of this out? Was there a charter that you made? Okay, do's and don'ts. You just kind of started.
Yeah, and I think our first office was as big as this space.
Right.
We had just one table. It was actually a white table just like this. We had like 5 people.
Yeah.
And we started.
All 5 in this space?
Yeah.
Okay.
And so we didn't even have a meeting room. There used to be a cafe,
Right.
Mocha,
Right.
just near our office. So if someone was coming to meet us, we'd be like, oh, just stay down. We'll come to
Right.
the cafe. Let's
Yeah.
have good coffee. Because we didn't have a meeting room.
Yeah.
And it's very funny if, for example, some employee wasn't performing well. Now, how do you talk about them? So there was a balcony,
Right.
Or there was the stair area where we'd go and we'd be like, oh my God, this person isn't working. Okay, how do we pull them up? What do we do?
So your conference room was a coffee shop.
Yes.
And your office had 5 people in it.
Yeah,
And today you're at what? 350 employees
Around
nationwide.
350, yes.
That's a big jump.
Alhamdulillah.
In what? 6 years.
Around.
So what do you
yes.
think was the key to success?
I think, so while we were really different people, I think one thing which was very similar was that we both were really ambitious. We both really understood the need of whether it's, the doctor community or the patient community. And I think, two crazy people who were lucky to have gotten a really, crazy team, as crazy as us, who helped us really build it.
Right.
So, for example, my CTO today, she's a girl who started working with us while she was doing her bachelor's at IBA, and she was interning with us.
She was doing her bachelor's and interning with you, and she's your CTO today.
Yeah.
She must be in her 20s.
She's in her late 20s. One person who's like a really important person of my founding team, she was actually working in the nursing segment in AKU. Then, she took a bit of a sabbatical from us.
Right.
She did her master's in health policy management. Today, she's leading our research and grants department,
Wow.
which is really important. She's, someone who's worked with WHO, like UNDP, UNFPA, all of them. And, I think, so I think the team was really important at that time.
Right. And so how do you place that bet on people who are young? You're young. You guys had not done this before. The people around you had not done this before. How do you place the bet, that this is going to be the right resource for this particular position, because you have no prior experience and neither do they. So it's difficult to place that bet. And I think all startup founders go through this. How did you deal with that?
I think in every interview, what we've seen is that there's supposed to be a spark in that person related with the kind of work they're supposed to do. And I think more
So
than
you look for passion.
I think that passion and some understanding of, how you want to really achieve and not just talk. I think that has been really important.
Passion and some idea of execution.
Yes. And we're not that young, by the way.
Well, you guys look young, so that's
Yes,
good.
yes.
That's good. And you raised a bunch of money along the way as well.
Yeah.
I think you guys did pre-seed, and now you're looking to get a Series A funding. And you've
Yeah.
committed, 66% of it already in this climate,
Around, yeah.
which is a difficult climate to raise money in.
Yeah.
How has the current sort of startup climate, and obviously there's a recession going on in different parts of the world, and Pakistan's got its own challenges. How has that, specifically the startup environment and the recent happenings in the news of startups failing, how has that affected you?
So I think it has really helped us re-strategize. I think one positive thing I feel that came out of all of this is that the bubble got burst. So a lot of misconceptions, a lot of, I would say, metrics to success.
So what were the
which perhaps,
misconceptions?
for example, I think a lot of investors as well as startup founders perhaps weren't looking at core revenue ultimately.
Right.
But for example, number of users, downloads, which of course hold its own, importance. But I think over the, last 1 year, a lot of organizations, startups, even investors realize that ultimately the company has to make revenue also, which is really important. I think
Revenue or
that
profit, because ultimately profit is what makes the company survive.
so revenue, which leads to profit. So I think that understanding has evolved over the 1 year.
So no one
especially-
was really looking at the path to profitability.
I think they were, but they were also looking at a lot of perhaps false promises, pitch decks,
Right.
Forecasts, which weren't.
But these are smart people who are
Yeah.
looking at that and investing money. I mean, their job is to put in money into businesses. How is it that they were missing some of the glaring issues that have come to light in some of these startups?
I think they were not missing. I think there was a lot of hope. And had the environment been better, had the political scenario been better, or for example, our currency stronger, maybe those dreams could have really evolved into something. But I just feel that some companies took a lot of risk, and somehow the world wasn't prepared for that risk at that time,
Right.
perhaps. Yeah.
And so your team saw this happening around you. Did you change the way you define success at your business over the last 6 months or maybe a year?
I think the good thing is when we started the organization, we started by creating a network of e-health clinics.
Right.
This was focused for the low-income population initially, where we were getting sustainable revenue.
Right.
Even if the numbers are really subsidized or low or discounted, we were getting revenue from day one.
And that was the low income population paying
Yeah.
to
yeah.
consult with one of
Yeah.
your telehealth
Yeah.
specialists.
So from that time onwards only, me and Sarah, we heavily focused on the fact that any product that we build has to be sustainable.
Right.
So even if it's one clinic, we make sure that that clinic becomes sustainable in a 12 to 18 month period. If an investor or a donor is funding that clinic,
Right.
in year 2, we don't want to go back to them that, oh, the clinic didn't work, we need more money.
Okay.
We were always sure of that. In 2019, when we ventured into the app business, we had a lot of partnerships with the corporate sector already.
Right.
So for example, we were working with the pharma sector.
Right.
We were working with the banking sector. So we started from that. When COVID came,
Right. Right.
We partnered with the government for our consumer app, which we gave out free for around 6 to 8 months. That
Okay.
helped us gauge a lot of users. But at the same time, we gave a corporate application to all the organizations who had to work offline, who had employees who they wanted to take care of, but who they also wanted to make sure they were motivated enough to work while they're at home. I think we leveraged there.
So you pivoted.
Yeah.
So in a sense, your business model went from B to C, where it was you initially thought of low income
Yeah.
consumers who didn't have access to healthcare or good doctors in their areas, but they did have a smartphone or,
Yeah.
or a device that
Yeah.
could connect them to someone. And you moved from that to a more corporate B2B model.
Yes, yes.
And how did that change your revenue or path to profitability?
That changed drastically. If I only talk about the COVID era, we had a good 300% plus growth.
Right. Because
From
all the
ha-
corporates
yeah,
wanted to subscribe.
Yeah. So from before COVID, from having hardly 3 companies using our service,
Right.
by the end of COVID, we had around 57 companies using our service.
So COVID did the work for you.
COVID did a large part of the work.
Yeah.
I think the acceptability towards digitization, the ease of using a phone, I think it really accelerated.
And the whole work from home culture also.
Yeah,
People
yeah.
got comfortable interacting and engaging with someone on the other side of the screen.
Yeah, yeah.
Interesting. And so now you're basically, if I was to define the business, your business is a B2B business model that takes corporate clients and allows their employees to use the app for free.
So free for the employee, but
Right.
not for the organization.
The organization pays on behalf of the employee.
Yeah.
So it'll pay a subscription fee, and all employees can use it for free
Yeah.
throughout the year.
Yeah.
And that is the core bulk of your business.
So that's the bulk of our business where revenue comes in.
Yeah.
The clinics as well as the consumer segment hold an important part because a lot of impact comes from the clinical segment. And ultimately, even if not today, but 5 years down the lane, maybe 3 years down the lane, the consumer market is going to be the bulk market.
Got it.
So we are present in all three, but corporates really help us grow in terms of numbers.
So why not focus on that? Why? Because if you think about corporates and the facility you're offering, it's a great facility. And let's say a company has to pay 1,000 or 2,000 rupees per employee per year just to access your app. That's a great value add for an employee, right? And it's not very expensive for the company. You can scale that into the region very easily.
Yeah.
So why not focus on just that being the business model? Why do you want to do clinics and do the B2C, which is much harder convincing people to pay the subscription fee, coming online? It's much easier convincing businesses.
I think we're catering to a country which has a huge population base.
Right.
Not every person is associated with corporate.
Correct.
If we say that we want to change the entire healthcare ecosystem, if we want to rewrite how the stories of health are written, that's
Right.
the motto that we believe in. We have to have an approach which is a multi-population focused approach.
So that's your vision. Your
Yeah.
vision statement is you want to rewrite what you just
The
said.
stories of healthcare. Yeah.
And are you limiting it by any geographic region, or just you want to rewrite the stories of healthcare?
So starting from Pakistan, we
Right.
do want to go beyond Pakistan also. But at this point, I think Pakistan itself has a lot
Right.
of healthcare challenges.
So rewriting the stories of healthcare opens it up. So that means you have to go B2C at some point.
Yeah. And also that gives us the edge over any other telemedicine company. There are hardly any companies in the corporate market.
Right.
There's no other telemedicine company creating such telemedicine-enabled e-health spaces in communities. And one advantage that gives us is that opens room for creating partnerships with the government.
Okay.
Because Pakistan, I think people in Pakistan and governments love to create infrastructure.
Yeah.
So we have a lot of hospitals, we have a lot
Yep.
of clinics, we have a lot of infrastructure, but oftentimes we don't have the people needed to be running that.
And so your hope is that you can
Yeah.
take this concept, take the technology, put it in place in that infrastructure and run the infrastructure and like a private-public partnership.
Yep. Yeah.
Very interesting. So women entrepreneurs, I'm sure this gets touched on as well. Is it difficult for women to be entrepreneurs in Pakistan?
It is. I think it's there worldwide, but I think it's more so in Pakistan.
Why is that? I would have thought that it's easier for women in Pakistan.
No, it's not.
We were the first country to have a woman prime minister, so we take pride in these things.
I think there's a lot of respect for women in Pakistan, but there's a lot of inhibition also. So I think it's a very patriarchal kind of a society where we don't want them to have their opinions.
So give me an example of when it was a challenge as you were trying to grow your business, being a woman entrepreneur.
I think every day.
Really?
So for example, I'm both me and Sarah, we both are mothers also. So for me, my workday doesn't start at like 8 or 9. My workday starts at 6.
Right.
When I'm planning my children's school drop off, okay, what was their homework, their lunch. Then, in the afternoon, I have to make sure whatever meeting I am at, I have to pick them up.
Right.
They have to be, placed somewhere safely.
Right.
They have to finish their homework. While raising investment, for men, we realized it was always very easy that, okay, come over, let's play golf somewhere.
Yeah.
Let's meet in the evening.
Yeah.
But, as a mom, I have to be home after 5 because there's so much, other chores waiting for me at home.
Right.
So
the scheduling and the juggling of schedules is the biggest challenge, especially as parents.
Yeah, I think there's not a leveled playing field. So and I'm sure you must have read it, but even today, even globally, a lot of domestic responsibilities come on women, whether they work or not.
Right.
So I think the society really needs to change their mindset that how men also need to contribute, not just in terms of finances, but also in terms of the day-to-day chores, whether it's children's homework, picking them or dropping, even by small things. Also, I just feel that, when women are raising investment and they have questions pertaining to, for example, equity or how much share investors should have or should not have, whether they need a board seat or not. I think a lot of eyebrows are raised. They're like, okay, she's asking questions.
Oh, really?
But I think it's changing. It's evolving. Especially, I think...
So people are not expecting... You're saying that as you go out for capital raises... the people you are presenting to are taken aback when you're asking for your rightful share against...
In the initial days, when we were quite young and naive, yes. Now, I think as we have progressed, we've also gotten older, more wiser. Now, gender is a second conversation.
But that's because your business has also matured with time.
Yeah.
Do you think that so like compare yourself, let's say 6-7 years ago, to startup women co-founders today, do you think they'll face the same challenges you faced 6-7 years ago?
Probably lesser, because we and a couple of others have set some examples. They have proven that gender doesn't define an organization or a team success. But I think still we have to go a long way.
So what would be your one piece of advice that, keep this in mind or do this, and this sort of helps navigate as you're on your path to entrepreneurship?
So I think something that we did, I think very early on we realized that for us, gender is going to be secondary. So when we are entering into a meeting, we leave the gender behind. So if I'm entering into a meeting, I'm the co-founder and COO of a company, whether I'm a woman or,
How do you leave gender behind in a meeting?
I think over time, as you become more mature, more wise, somehow it does become a secondary conversation. It does come out sometimes. For example, I remember, meeting someone and, they had this thing that, okay, bring the oldest person in your team.
Right.
And we're like, okay, we are the oldest, there's no one older than us. Or
you were requested to bring the oldest person in your team?
Yeah.
Why?
Yeah, because a lot of times people still have this notion that, okay, these are two women, there must be some man behind them who built it. How could they just, build it themselves?
Right. Even though you said we are the co-founders.
Yeah. So a lot of times people, in the early days especially, used to have this thing, who's behind this? Yes, you are the
face of it.
Yeah, but who's behind it? So
and they were expecting a man's name.
Yeah.
Interesting.
So that used to be
And that didn't bug you guys?
I think now is the time that we actually, enjoy that.
Okay. You look back and it's interesting and it's funny now, but at that time, it didn't bug you?
We knew that, okay, maybe this is not the partnership that is meant to be.
Right.
Yeah. So I think over time we knew that we had to make really wise decisions, which has really helped us. But I think we've met some amazing people also. One thing that I also highlight here is that a lot of our success has been, God sent kind of, We've met people who just helped us by the way, who were just supportive, not needing anything in return, no favors, but just because they kind of saw the vision.
Right.
They saw the passion. A lot of mentors, in our journey,
Right.
who maybe are not working with us today, or maybe, we don't get to meet them every day, but people who just really helped us, even our early investors.
Right.
So for example, Danish Elahi, a couple of people, Raza Mateen, these are people who, just trusted us when we were very new in this business and we were just, creating our mark. So I think they will always be remembered.
Interesting.
Yeah.
Good. And you picked, so you found, you happen to be doctors, trained doctors, and medicine, as we discussed, is a very woman-focused career path where there are more women doctors than there are men. And so you found a business opportunity in a space that was predominantly women. As young, let's say, startup entrepreneurs are looking for opportunities, and I'm talking about women startup entrepreneurs, what spaces, other than, let's say, a woman-centric space like this one, what spaces do you see an opportunity in that women should go after?
I think a lot. Law is another segment where there are a lot of women who have graduated,
Right.
but because of the scenario,
They're
they
not
don't
practicing.
practice to their full potential.
So you can take the exact same model and paste it onto law, like the
You
Sehat
could,
Kahani,
or maybe
Wakalat Kahani.
Wakalat Kahani. Yes,
Right.
I think engineering is another area.
Not as many women there.
Not as many women, but the ones who are there, I just feel they're not represented equally. Women are there in education sector already, so I think
Yes.
that's an area which is already saturated. But I think law is one segment which can
Right.
really take advantage of digitization. Something that Food Panda already is doing, bringing out home chefs.
Right. Okay.
So that's an interesting concept.
Yeah.
It allows a lot of women an access to earning money, in a way which they weren't able to earlier.
Interesting.
Yeah.
So law is something you think that if you can digitize law,
Yeah.
there is an opportunity there.
I think there is. Yeah.
What about medicine? Do you think a career in medicine is, in the next 10 years, still going to be as relevant as it was maybe, let's say, 10 years ago? With automation, with AI, a lot of things standardized. There's a lot of data being pulled in. You can now use tools like ChatGPT to ask questions, and you'll get detailed answers. Medical answers as well.
Yeah.
So the telemedicine concept, could it technically be eroded using AI because of AI? And if so, does medicine still have the same kind of career progression or career path that it once did?
So I think that's a very interesting question. I was just speaking to a doctor friend who works in UK, and he was talking about how they're constantly having those AI and robotics workshops.
Right.
Because the healthcare sector there is heavily moving towards that. And it will move here as well. But I think we will be needing a mix of both for two reasons. Task shifting is something which is really needed in Pakistan. So, for example, if someone needs to, for example, know about an ailment or know about a disease, there should be chatbots which are not backed by people, which gives authentic information.
Right.
Because we really need to reduce that task away from doctors and nurses and other healthcare professionals.
Right.
They need to be doing more serious jobs. But I think, again, the level of education, the kind of financials people in our part of the world have, and because of the lack of education, the lack of trust that they have on technology, it would take another 5 to 8 years to really eliminate healthcare professionals or doctors or nurses from some segments. Also, in a country like ours, where I think healthcare is not regulated the way it should be, there are a lot of chances of mishaps if it were to divert towards that kind of task shifting where a lot of workload is moved towards AI so quickly.
Right.
So till all of that isn't in place, till stringent regulations, stringent protocols and trainings are not in place, we are absolutely 100% sure. I think that would take a bit longer for AI to kick in. But having access to doctors through telemedicine, having
Right.
access to physicians, nurse professionals who are trained for liaisonning and triaging, I think that is the next big thing.
Right.
That is our first shift. The West has shifted towards telemedicine, and now they are moving towards AI. I think our big shift, which is happening now, because you see a lot of telemedicine, digital health organizations coming forth, which is good. We need this at this point with the evolving and the ever-growing population. So I think we really need to move towards having a lot of doctors, nurses who can do triaging through telemedicine, through digital health. That is the next big move. We are already moving towards online pharmacy, online claim management, all online deliveries, online diagnostics.
Right.
And by we, I mean, Pakistan overall. So we need more of this in even the more remote cities. So, for example, a service which is available in Karachi should be available in, for example, Sargodha, Sialkot, all of those cities as well. And I think after that, once this is saturated, then the move should be towards AI.
So there is time, especially in a market like
Yeah.
Pakistan. We
Yeah.
will not see, at least for the next 10 years, maybe even 15 years, the career path of medicine change significantly.
15 years is a lot, maybe, but maybe in the next 8 years.
Yeah.
We should start introducing those changes. So, for example, I feel all the medical colleges now should have telemedicine and digital health bid embedded in their course. Any doctor who's specializing should also be trained how to practice through telemedicine.
Right.
Because that requires a different way of practicing, a different way of communication.
Right.
Unfortunately, in our part of the world, doctors come with this God phenomena that they don't
That's true.
want to talk to patients.
Once you've got the doctor title,
Oh,
then
yes,
you've
yes,
just earned
yes,
everything.
yes. And a lot of these doctors change after they've gone abroad, they've done their trainings.
Hmm.
They learn, that communication skill. So I think that's really needed here.
And telemedicine, that I think is the biggest part of telemedicine, is that communication skill,
Yeah.
because you're not physically present in front of
Yes,
that person
yes.
to understand how they feel, or you can't see how they feel.
Yeah.
You just have to hear it or on a voice call or see it through a video at best.
Yeah.
Interesting. What is my last question to you, what is your sort of vision for, let's say, everything goes according to plan? What does Sehat Kahani look like in the next 5 years if everything goes according to plan?
So as I said, I love to dream, and then
Which is
Sarah
why I'm
pulls me
asking
back.
you. You're the dreamer. So what's your dream?
So I think, but if I were to talk about it collectively for both of us and for the organization, I think we want to ensure that Sehat Kahani is a household name. Every person who has a phone should have a Sehat Kahani app in their smartphone. They should be able to know that this is how they can access a doctor.
Right.
Any person who's working in a corporate should know that, okay, whether it's a doctor, whether it's a mental health expert, whether it's a specialist, whether it's online diagnostics, online medicine, I should be able to do it through the Sehat Kahani channel. And also, Sehat Kahani should not be limited to Pakistan, where it should be a success story celebrated in the South Asian region and beyond.
So Sehat Kahani, in your view, should be synonymous with medical need.
With any primary and secondary medical need.
With any
Yeah.
primary and secondary medical
Yeah.
need. It's funny you mentioned this, because just right now, just today, and my wife's a doctor and she's, been practicing for a long time. She's had this lower back pain that keeps coming and going, and she's tried everything. Nothing's worked. Everything, like literally everything. And today she's like, I don't know where to look to find any options I may have missed.
Okay.
And we were both scrambling and trying to figure out, okay, maybe to try a chiropractor, to try a different physiotherapist, try acupuncture, cupping. I mean, try everything, right? And literally, we were both discussing, it would be amazing if all these options were centralized in one place, where I could say, this is my problem, what are my options? And I think what you've just said, Sehat Kahani could stand to be that solution.
Yes, inshallah.
Inshallah. Well, congratulations on your success. And best of luck on raising the rest of the money that you have planned to raise.
Inshallah,
I know it's a
inshallah.
tricky environment, but you guys have been very persevering entrepreneurs, and I think you guys will be extremely successful. And I think you have a fantastic app that you've developed, a fantastic business, and I wish you all the best.
Thank you so much. And it was a lot of fun,
Good,
being
good.
here.
Thank you for
I had a
coming
great
by.
time.
Yeah.
Thank you.
And thank you everyone for tuning in. Stay tuned for more episodes next week. Bye-bye.